Recording in progress.
Ya te metiste, ¿verdad?
Sí. Pero no me puedo ver. ¿Me puedes ver tú?
No. Ah, no, sí, ya.
¿Ya me estás viendo?
Ya.
Hola. ¿Me uno como panelista?
Sí.
Recording in progress.
Y Dios, ¿me puedo ver aquí?
Ujú. Fíjate cómo te ves, ¿verdad? No, es para que sepas que la presentación está atrás de ti como en la espalda.
Siento que me gustaría que estuviera más arriba no se me ven mucho las caras.
No, aparte que tu imagen se ve muy chiquita.
Me gustaría que estuviera un poquito más alta la computadora. No, digo, mira, ¿vas a hablar mucho o?
Unos 5 minutos. No, bien, por favor.
¿Cómo?
Ya fue con el Hi, good morning, and welcome to Weight Loss Surgery 101. Hi, Leili. Welcome to our webinar. We are just giving a couple of minutes to make sure that everyone is set up. So if you have any questions, you can submit them to our chat, and we are going to start promptly. Thank you very much. Hi, Leili. We are going to be starting in 5 more minutes. Thank you for joining us, and thank you for attending our webinar. We are going to be starting in 5 more minutes. Thank you very much. Let us know if you can hear us, Leili. Thank you. Thank you for attending our webinar. We are going to be starting in 4 more minutes. I see that some people are already joining. Can you please let us know if you can hear us well? Thank you very much. Hi, good morning. Thank you for attending our webinar. We are going to be starting in 1 minute. We're just giving a little room for people who are joining in still late. Dr. Valenzuela is already with us, and so we are going to be starting in 1 minute. If you please can let me know if you can hear as well. This is just a test for the audio. Thank you. Hi, good morning. We are going to be starting in 1 minute. We are just giving a little room for the people to join us. Thank you very much for joining our webinar, little Q&A with Dr. Valenzuela. We are going to be starting promptly. Please bear with us with one more minute. Thank you. Hi, everyone. Thank you very much for joining us today for our live webinar, Weight Loss Surgery 101, a quick Q&A with Dr. Louisiana Valenzuela. My name is Luis, and I am the patient coordinator for Do It Bariatrics, and we are so excited to have you here with us. Whether you're starting your research or considering weight loss surgery, or if you're already planning to have your weight loss surgery, you've come to the right place. Thank you very much for joining us. We are going to start immediately. Okay, first of all, talk a little bit about who we are. We are Do It Bariatrics. We are a multidisciplinary group that focuses on providing bariatric surgery for international patients in the city of Tijuana, Mexico. Our main goal is to provide a VIP experience for every patient from the start to the end of your journey. Whether to start with the research, providing all the information that you need to make an informed decision, and then to help you with everything that is related or needed for you to have a bariatric surgery, a successful bariatric surgery. So that is our main goal, and that's who we are. Our lead bariatric surgeon is Dr. Louisiana Valenzuela. It's a world-renowned bariatric surgeon. She's a double board certified surgeon. She has certification or certified as a general surgeon, but also as a bariatric surgeon. And she is the head of Do It Bariatrics. And this is like a very important fact to mention, is that Do It Bariatrics, it's the only official channel to book a surgery with Dr. Louisiana Valenzuela. Most of our protocol focuses on providing the best experience, like I was saying, on a patient-centered care. Dr. Valenzuela has compiled a team of medical professionals that have all the experience and the expertise in the field of bariatric surgery to provide the best possible patient outcomes for international patients. And also, Dr. Valenzuela has teamed up with only top-notch facilities, hospitals, and logistic professionals in order to provide a comprehensive service from everything that is related to the surgery, before the surgery, and more importantly, after the surgery. Our patients usually recover in Blue Medical Hospital. That is like one of the most modern facilities that is exclusive in Tijuana for medical tourism. And this sets us apart because all of the staff from the hospital, from the logistic, and from everyone at Do It Bariatrics and also at Hospital Blue are experienced and catered to international patients. Every member of the staff, it's bilingual and able to provide you with any service and without any complications in the communications directly with you. In the screen, you can see a couple of pictures of what Blue Medical Tower is right now. As you can see, and as you can witness on the images, it's a top-notch hospital with private rooms and private transportations, everything related specifically for international patients. A little bit more pictures on the screen, so you can see a little bit more about Blue Medical. Blue Medical has, when you can see on the screen, a very important and convenient location. Blue Medical Tower, and actually our office is just 25 minutes away from San Diego International Airport. This convenient locations, it's with to make it very easy for everyone considering weight loss surgery in Tijuana. So we have a very complete package and a very complete service with our whole VIP experience. Tijuana, Tijuana, it's a premium medical tourism destination. As you were seeing before in the map, we are located right next to San Diego, California, which makes it one of the favorite destinations for bariatric surgery in the whole world. I think, and I'm very safe to say that currently the city of Tijuana, it's probably the city that performs more bariatric surgery on daily basis for the last 10 years. And it's been estimated that thousands of patients weekly visit Tijuana for different medical services. And one of the most sought after procedures that people come to Tijuana for, it's weight loss surgery. And in here in the screen, we can see Dr. Valenzuela with a lot of our patients, a lot of our international patients that have visited us and that have experienced our VIP patient experience. And well, just before we start our session with Dr. Valenzuela, this is just a screen with the different all-inclusive package, and I'm just going to stop a little quick in here and explain what we mean with all-inclusive. With all-inclusive, we mean that we have compiled a package with everything that you will need to have a successful bariatric surgery. And when we say everything that you will need, typically our patients just need to make sure that they arrive to San Diego Airport. Once the patient is in San Diego Airport, we take care of everything that you will need to have the successful surgery. All of our packages are considering the patient and one companion. So typically what happens when you have a bariatric surgery with Do It Bariatrics is the following. You typically will have to consider a trip of at least 5 days. On the day one, the patient arrives to San Diego Airport, and then we pick them up directly from the airport and take them to Tijuana, to the hospital, or it could be to the hotel, depending on every itinerary. On the second day, typically it's the day of the surgery. That day you will spend it on the hospital. The hospital has a private room where your companion is more than welcome to stay with you. And this is what usually happens on the second day. Before the surgery, it's obviously the preoperative assessment, that once everything is ready, you can have a successful surgery for you on the hospital. Usually, most of the surgeries require the 2-day stay at the hospital. And after the second day, you get discharged for the hospital, and then you go to the hotel or directly to the airport, depending on each patient itinerary. Usually, when we gather a patient, we have a protocol where we assess every case. And according to every case, we design a customized itinerary with your days of recovery, your days of stays, and your days of transportation. But one of the great things that sets Do It Bariatrics apart, it's the fact that we are that we have a very customized experience. So the experience is very accommodated to each patient needs. In here, one important thing also that I forgot to mention before, it's that the multidisciplinary group that caters your surgery, that Dr. Valenzuela will explain a little bit more about this, have not only like the surgical part, but everything that it's not surgical, from the pre-op from the pre-op diets and the post-op diets. We have a nutritional department, a dietitian that focuses and helps you with everything that you will need. We also have a team of medical professionals that provide inhalotherapy to prepare you before the surgery and after the surgery. And we also have well, all the doctors that work closely with Dr. Valenzuela, that she is always very hands-on and on top of every member of the team. In the screen, it's just some transformations, some patients that have been bariatrized or have been had their surgery under Dr. Valenzuela, success stories. So you can have a little bit more motivations. So without any further ado, I will introduce Dr. Louisiana Valenzuela, that I will make the host of this webinar. She will be talking a little bit more about the specific surgeries and the difference between surgeries, and then we will start the Q&A session. Dr. Valenzuela, I will make you the host of the webinar.
Hello, everyone. We are here to talk about the bariatric surgery and what are the expectations in the process and the final experience and the final results. Okay, to me, it's very important to see me. You can see me like your doctor, and get all the information you need to get the decision at the end to come and get the surgery. That is the most important to me, because I like so much to have very well informed patients before come to get the surgery. It's important to know the expectations, to know the risk, to know all the experience here, what will happen when you come, what will happen in your recovery time, and what will happen after the surgery. Okay. Of course, I ask to my patients the health questionnaire, and it's important to see any tiny situation or history from our patients, to be careful in the pre-op and during surgery, risk factors to care, especially in that risk factors in our patients. It's important if the patient has a history of the previous surgeries or previous blood clots, for example, or another situation who we need to be aware about the how to take a special cares to our patients. Okay, so you no veo la pantalla más que veo Luis Do It Bariatrics. I'm sorry.
You can continue. It's
sorry, we are putting our screen in the same. I can't see the screen in my monitor. I can't see the presentation, Luis. Could you help me?
yes. I will need to be there.
you change something because before I go see the monitor and now I can see nothing, just Luis Do It Bariatrics and maybe my assistant see the same monitor. Well, it's a different type of surgeries in the bariatric field. The most common and popular who are in the last 10 years maybe is the gastric sleeve surgery. The gastric sleeve surgery is very popular because the gastric sleeve surgery is low risk surgery. It's easier to perform. It's very well accepted from the patients to the patients because they feel they are not having an aggressive surgery, and that is true. It's the less aggressive surgery, but we have a very good results with gastric sleeve because we had a good restriction who in the most of the patients is the perfect tool to control the amount of food in every meal and eat, of course, less and fewer calories in every meal with this tool. Remember, the surgery is a tool, and I like to remark this because it's important to know that the tool, it will works and it will give you this weight loss for sure, but at the end, the patients need to start to modify the style life. And it's not a dramatic change. It's a small change that could help to maintain your lose weight for long term. And what is that simple things? Well, to choose very well your calories, your meals, healthy food, protein, increase the protein in every meal is the key. 2, do exercise. The exercise is need to be part of your day, a day, at least 4 or 5 days a week. It will be necessary, and it's not a hard workout. It's medium, low impact, but a constant, it will be help you to maintain. Well, return to the sleeve surgery. The sleeve surgery, again, I can see you so only the, right now it's but I can change the screen. Okay, the sleeve surgery gives us the opportunity to eat less. We remove the 80%. We talk about portions. We remove the 80% of your stomach. So we let you just banana shape to say in one word. Your stomach is like a banana shape, and you will reduce a lot the amount of the food. The hormone, ghrelin hormone, it will be removed from the top of the stomach, and that is a very good extra tool to control your hungry. That hormone control the signal to the brain to say if the stomach is empty or is full. So when we remove that part of the stomach, the top of the stomach, the fundus, we remove that hormone, and at the end, we give to the patient the extra tool to cut the signal to the brain to say that you are empty or full. So the gastric sleeve, it's laparoscopic surgery where we cut the stomach with a staple, a special device who put a titanium staple in all along the stomach, cutting and cutting putting the staple and cutting at the same time and removing that part of the stomach. Over the line of the staple line, we put stitches and we do this long suture over the stitches, the staples, to prevent any leak or any bleeding situation, okay? Because our experience is huge, is very over 10,000 patients. We know that the shape and the straight sleeve is the key to avoid and try to avoid any acid reflux, leaks, obstruction, or other situation in the technique. Okay, so that is very important because our experience give us the security to do the correct technique and correct gastric sleeve to give to the patient the safety procedure and don't have at the end any complication because the technique is wrong or the sleeve is twisted or with narrow zones, who are the most common complication with the gastric sleeve. We don't have that because we know how is the correct technique and correct dimensions with the boogie to perform the calibration with the sleeve, okay? So at the end, this surgery is 45 minutes in the surgical room. Because our experience, we are doing the surgery in different approach. One of the methods to perform the surgery is a single incision. The single incision is just one incision through your belly button, and that it's, of course, less scar tissue. It's aesthetic is much better, and it will be, it's the same recovery at the end, but it's just for aesthetic. The other is the 3 incisions, who is the TILS, the 3 incisions laparoscopic sleeve. We perform the sleeve just with 3 incisions. In the 99% of my patients, to get gastric sleeve, I don't use a drain tube. We know the drain tube, it's increase the risk to get bleeding, increase the risk to get bad recovery from your anesthesia when you try to breathe deep because it's painful. And of course, the pain increase your high blood pressure, and that increase the risk to get bleeding situation. So we know no drain, it's better, and we do the perfect hemostasia in the surgical room to don't need to put a drain with our patients, who are the best because the recovery time, it's much better, less pain, less risk to get high blood pressure and bleeding situation, and your oxygenation, it will be much better because you can breathe deep without drain, because the drain is very boring you all the time when you try to breathe deep. It's boring you, and without drain, of course, you can breathe deep and your recovery is faster. You can walk faster and less time. You can put in walking, taking ice, and your recovery is most easy than with the drain. So the regular gastric sleeve is with 4 incision, and this is when the patients have the liver a little large and a little heavy because the patients had this fatty tissue condition. And then we need to put a liver retractor. So it's an extra tiny incision, but at the end is 4 incisions. But our regular gastric sleeves are from 3 incisions because our patients do a very good pre-op diet, who are very important to get the surgery. The pre-op diet give us the less inflammation in your liver and in the fatty tissue around the stomach. We are doing this pre-op diet not to lose weight. We don't need the patient lose weight or lose a lot of pounds. The intention for the pre-op diet is to get this anti-inflammatory time in the liver, in the fatty tissue around the stomach, to get easier surgery, less risky surgery, and the good recovery time after the surgery. So let us, this the next slide. Okay, the other surgery, it's a gastric bypass. We are in the field of the malabsorptive procedure, who are the bypass, the mini bypass, bipartition, duodenal switch, and others are in this field, the malabsorption surgeries. The gastric bypass is a very good tool. It's a very good surgery. The surgeons name this surgery like the gold standard of the surgeries. Why? Because involve a lot situations could happen with the patients. Like if you have gastric acid reflux, the gastric bypass is the ideal surgery. If you are in bad control of diabetes, gastric bypass is the ideal surgery. So the most of the patients have situation like this, and the best of this surgery is that the patients look like the long-term weight loss is more sustainable that, for example, a gastric sleeve. But I say any procedure could fail for, say, in one thing, 1 minute, if you don't follow up the recommendations. Okay, any gastric bypass or sleep could be failed at 3, 4, 5 years if you return to your bad habits. So I prefer to say that the gastric bypass or any other surgery help a little more or less in case you have a special conditions like your diabetes is in bad control or your acid reflux is in bad control. So this is a very, very good tool. The gastric sleeve, it's a very good tool too. And the difference here, it's individualize the patients. For example, if you are in peri-BMI, who are just in the borderline in the obesity, well, if you don't have any acid reflux on other conditions, the gastric sleeve is the perfect surgery for you. But in other case, if you are in 40, 45 BMI, you have this diabetes or another condition, well, the gastric bypass is the best tool for you, okay? So it depends, and we need to see the history, the health history from everyone to choose and be in the choosing the best se ve mal otra vez, lo quitaste. The best procedure for you. Okay, the gastric bypass is, we perform a little pouch in your stomach, and then we bypass the intestine 1.5 meters down to the foot, come to directly to the small bowel, and we have less absorption. We absorb fewer calories. Of course, the amount of the food is less too, and we have this specialized system in the hormones to control much better your glucose, your insulin, and your pancreas works different from the other surgery because this is a more metabolic surgery than others. The gastric bypass prevent or avoid the gastric acid reflux. And we have a very good complete tool with this surgery. The other type of bypass is the mini bypass. The mini bypass combine the long pouch who give us a restriction plus the malabsorption. But in this surgery, we have just one anastomosis with the intestine. In the previous example, like complete bypass, we have two anastomoses, two different sides of cut, and joined with the one is with the gastric pouch with the stomach, and the other down. It's intestine to connect the bilis again to the side where the food is coming down from the first pouch. So in the mini gastric bypass, we have just one anastomosis, is less risky, is the same metabolic system to change your hormones and improves in your glucose in your pancreas to control the insulin, control the diabetes too. The difference here is if you are with acid reflux, well, this is not the ideal surgery because we could have in a small person, but could happen, the bilious reflux to the pouch and then to the esophagus. So that is that part who we need to avoid for sure in patients who have this problem with the acid reflux. It's both surgery is around 1.5 hours. It's 4 or 5 incisions, depends of your liver. If your liver is small, it's just 4 incisions. If your liver is large, we need to put the retractor liver, and it's 5 incisions at the end. The recovery time is the same for the 3 surgeries. It's 2 days in the hospital, 2 nights, and little by little you will recover your oral way. We start with eye ships, then increase to clear liquids, and at home we will start the complete of full liquids, and then the third step, it will be a soft food. But we give to the patients all instruction in papers. We give to the patient all instruction in with a summary of your procedure, what you need to check time of time in your lab test, when you need to come to the doctor to check your results of your labs, and what you need to care about your nutrition. And of course, you will have the contact from our nutritionist or dietitian to help you in all the journey. We are always open to receive any question from our patients because it's important to be shoulder by shoulder with my well, care. I like to receive all the question. If the most simple question is very welcome to clarify, because it's important to do the correct things after the surgery. It's not complicated, but sometimes the patients need to resolve the doubt to continue with the follow-up. It's important to be clarified that the surgery, it's easier, and you will you will starting your normal day a day in 7 days. But from the surgery to 7 days, you will be walking, doing your exercise, breathing, starting your clear liquids, little by little to reach your first step, and then continue with the diet to the second step. The first month is very fast, it's not complicated. You will transform your diet in 3 weeks to almost normal diet. Of course, the amount of the food, it will be very small bites, but it will include all type of food, of course, no processed foods, of course, no gas beverage, and we will care of the quality of the food for you, but it will be like eggs, tuna, chicken, all different kind of meat. Of course, in the first months, it will be hard to take bites of lean meat, but little by little, you will incorporate your different type of food, like a newborn baby, when they need to start to eat different type of food is the same, but of course here is a little less caring. You will start with the cooked veggies and pasta little by little, and all type of veggies or all type of meat, or lean meat, or different sources of protein. And you will see what is the best for you and what is the best states, and how you receive, your body receive this again protein bits, and you will choose what is the best protein or the best options for you. We will give you all the options and you will choose the best for you. Of course, we will give you all the vitamins, protein, calcium, all supplements you need to take, and how you need to take, because it's not just take this pill and that's it. No, you need to separate the calcium from the iron. You need to separate the vitamin D, calcium from the iron, from the time you can take it, because it's different absorption and it's selective absorption. So we will guide you to do the correct things and approach all the supplements correctly. And the protein, I know because the patients say it's hard to reach our goal of protein, but we push the patients to give the best tips to reach the protein, because it's important to take the amount of protein you need to take daily. And that is the most important for the patients. Well, another type of surgeries is a revision surgery. The revision surgery is when some surgery had this reganate weight. Some surgery has, for example, acid reflux with the sleeve. So we need to think in revision surgery. Revision surgery is for patients who wants to restart the lose weight loss, and is for patients who has acid reflux. It's not good for the esophagus, or is constantly the acid reflux, then we need to think in revision surgeries. It depends what happened with the patient. No, it's just for control the weight. It could be for another situation like acid reflux. But the most common situation is because the patients regained weight. So we have the options to convert the first surgery in other, or do redo, for example, the gastric bypass. The gastric bypass revision to gastric bypass revision is a possibility where we take from others, doctors who did the surgery, and maybe it was 15 years ago or 20 years ago, and we saw that the surgery is not the correct length measures, and we perform again the anastomosis, but in correct position and incorrect length measures. So this is a special surgery for special patients, and we need to talk with the patients to see what is the best revision or what is the possibilities to get a revision. Some patients want a very aggressive surgery, and I always say we have a lot options to lose weight right now. The balloon, the medications, the different surgical options, but here we in our treatment with my special opinion, the patients need to get the less aggressive procedure with the best results and don't put in risk the quality of life, who is the most important. And these surgeries offered to the patients not too much aggressive treatment, but with results who are in all this time given the results from the all kind of surgeons in the world doing these same surgeries, and that the results that helped from us. So if you want just to choose one of all these type of treatments, maybe it's not the ideal for you. So we need to individualize every patient to choose the best option. So this bariatric procedure is not for all the patients. Every patient needs to choose the ideal procedure for them, and not too much aggressive, but not procedure who modify your maybe anatomy, but with bad quality of life. Like, for example, the lap band, who was the very popular surgery in the past. We know now that is not a good option for anyone. The balloon, I know it's a bad quality of life. The patients feel nausea, the patients feel pain, and they don't lose enough weight. So it's the reason I don't like the balloon, for example. The medications we know could works in some patients, but in others is not working and give a lot secondary effects. So the quality of life is poor too, and the expensive cost is thing who need to be considered, and it's long term using that, and when you stop, you could regain weight immediately. So we need to put in a balance what is the best option for every patient, not just to choose like in a store. And we need to evaluate every patient, and it's the reason when the patients come to me, I ask different questions like your history, what happened, if you had surgeries, if you had any eventuality. It's important to know what happened in the past and propose the best option. Okay, well, we can continue talk about the different procedures, but it's the most common procedure we are doing in our field, and well, I very happy to see if you have any question. Lady, it's right here. I know, lady, you, I remember you. you asked for the sleeve surgery, and if you have any question about your option of the surgery or any question, dude, about the procedure, the study here in the hospital. I think Luis talked about how it's the protocol. We pick up you at the airport, and then you come to us to the hospital. We do the pre-op lab test, the evaluation with EKG, lab test, the internist, who is the specialist doctor to do the pre-op evaluations, see you before the surgery. Of course, I see you again before the surgery, and all my team too, the anesthesiologists, and they will ask you one and another time the same questions to see we don't forget any important situation with the patient. And then the next day in the morning, we do the surgery very, very early to don't let the patients a lot hours without food, without liquids, or with the anxiety to get the surgery in. After that, we go to the surgical room, we do the surgery, you will be in the recovery time with us. When you wake up, then you go to the room, the final hospital room, and we have a inhalotherapist who help you in the breathing time to do very well your exercise breathing, and your recovery could be more smooth. Luis?
Yeah, sorry, it's a question here we have from Instagram. Can you explain the difference between a gastric bypass and a mini gastric bypass?
Okay, the gastric bypass is we named the full bypass, it's the complete bypass. The bypasses is in a small pouch in your stomach. It goes directly for your intestine, 1.5 meters. We jump all these meters in your intestine, and the food comes down. And then the bilies come again down 1 meter more to join with the foot down. So we do like it's J, it's the letter, and we have this pouch and this another anastomosis down, and this is the bypass, the full bypass with 2 anastomosis. And the mini gastric bypass, we have a long pouch. It's a longer than the regular gastric bypass, the full bypass. And we have this combination between the restriction plus the malabsorption. So in this kind of surgery, we have just 1 anastomosis. The foot come down 2.5 meters down, and the village joint in the same situation with the foot. The foot and the bilis is coming down at the end and in the same area. And we have just 1 single anastomosis in the mini gastric bypass, and that is because the name is mini, because we have just 1 anastomosis in this kind of surgery. The metabolism, to help in the diabetes is the same, like the full bypass. The hormones change, and the hormones helps to control the glucose, and the pancreas increase, so it's better to give us better insulin time and reduce the glucose resistance in the cells. So the both surgery helps a lot in the control of the diabetes and the control of the glucose. But the bypass, like I mentioned it before, is the best option in the acid reflux patients with this problem, no? Mhm.
There's another question from Instagram, Dr. Valenzuela. It's a two-piece question. It's and if the stomach will stretch after surgery, and how long after surgery can I drink alcohol?
Okay, the stomach could be stretched after surgery, but the difference in these situations, some patients says the stomach is come to growing up again, but not. The stomach not growing up again. It's just a stretch because it's a muscle, and the muscle could be stretched if you put and push more food inside. And yes, we have this compliance in your stomach could be wider if you push more and more food. But at the same time, if you control that, if, for example, if you take a lot of food and push water with food, solid food at the same time for a long time, your stomach, it will be stretched. But if you control that again and you say, no, I will do the correct things, the correct indication from my team, and you take again your rules very well, you don't take liquids with solids, and you control the amount of food to do your three meals in normal amount. The stomach again take the shape, original shape, and take the small amount again, and you will be satisfied, and your tool it will works again like in the beginning. So it's just in your hands to what to do with your tool. If you carry your tool it will be working normal like in the first year. But if you push and push more and more food, you will have this stretch time in your stomach. And the other question is the alcohol. Well, of course, we don't recommend alcohol because it's a lot of calories in every single intake. But the 3 months, it will be the time to try to take alcohol, because we have just not just the increase of calories in every time you take alcohol. If not, you can have dehydration after you take a big amount of alcohol. And we need to carry your liquids in the first months because your intake, it will be very low, and you will reach very adjust your portion of your liquids in your body. It will be in the borderline, so you need to care of that aspect.
Dr. Valenzuela, I have another question here from Instagram. A very interesting question. I think it's related to the first one. It says, it's guaranteed that I will lose my desired weight.
Well, we now have our average and the studies from all the surgeons in the world send the results in their patients. And we know the sleeve, the gastric bypass, the mini bypass has the average in their lose weight, and the average is to get the 85% to 100%. Some others say 70%, but in my experience, the patients lose 85% of their excessive weight in almost 95% of the patients. So that is almost a guarantee. Of course, this not depends just to the technique of the surgery. It depends to what good is your follow-up and how you care your tool, like I said, and your rules, and follow the rules, and take the good quality of food too.
Dr. Valenzuela, here's another question, very important question, I think. It says, do I have to stop taking weight loss medications before surgery?
The medications, we are talking about no resolve the disease, but we are talking in control disease. The diabetes remission, it's a fact. We have 85% of the remission in the diabetes, in the high blood pressure, in the patients who was under cholesterol or triglycerides treatment, and that they take off all medications in the 85% of the patients take off all medications because they have a remission or control of the disease. And this is a fact, and we know that happened. We can't talk about cure because the diabetes and the high blood pressure don't have a cure, but has a remission and a control, a very good control of the disease.
Okay, thank you very much, Valenzuela. I think that's all the questions that we have from Instagram, from Zoom, and from all the other platforms where we are broadcasting. But if you have any additional questions or you need any further information about bariatric surgery, about our medical tourism protocol, about in general the service that we can provide, feel free to contact us. Our phone number is 619-598-8133. Again, 619-598-8133. And you can always visit us at doitbariatrics.com, and you can follow us on social media. Thank you very much, Dr. Valenzuela, for joining us. Thank you very much for taking the time to host the webinar. I know that you're busy, but in the name of the whole team of Do It Bariatrics and the whole patients and the whole audience, thank you very much, and thank you everyone for joining us. This webinar has been recorded, and the recording is going to be sent out to anyone that couldn't attend.
Yes, remember this webinar is not just for the patients who attended, it's for the patients who are asking questions. We send the seminar for the patients, the webinar for the patients who are interested in the surgery to try to explain what happened, what to expect with the surgery, and we will put the webinar in YouTube too to be ready to see if you don't or couldn't be in the webinar. We put in the YouTube to can see you in the next days. So thank you for attend. If you have any extra question, we are open always to receive it. Okay, have a nice day and good to see you.